So we are sending more vaccinations to Spain, and here is why. Meet your Team 9 data detectives. Niels from Taiwan, vaccinated 3 times and had COVID once. Janaina from Brazil, vaccinated 4 times and had COVID once. Myself, Akshi from Kenya, vaccinated 3 times and had COVID twice. Henry from Peru, vaccinated 3 times and has never had COVID. And Stefano from Japan, also vaccinated 3 times and also never had COVID. Just from this small statistic, you can see here that your data detectives, out of 5, over 50% have actually had the COVID-19 virus. We have also implemented CC closed caption subtitles for those who will benefit from them. So, we are here today to unravel the mysteries of vaccine distribution. As your data detectives, we have embarked on a mission to analyze real-time data in a world still being grappled by the COVID-19 pandemic and to answer crucial questions on vaccine effectiveness and distribution. In this presentation, we are going to leverage real-world data to figure out the trends in COVID-19 cases and deaths over time, to show you the vaccination progress and regional disparities in the regions that we have narrowed down. We will also show you the correlation between vaccination rates and pandemic outcomes. And last but not the least, tips and tricks on how to use this data to optimize vaccine distribution for future preparedness. So, first and foremost, we're going to start with an overview of the number of cases in the world. This is a world map that has been color coordinated to show you the intensity of COVID that is running through the countries at the time. Obviously, this is not a great visualization, and you can see here that the green colors are those countries who are not battling it so badly versus the population, versus the red countries who have higher populations and higher COVID cases as well. But we can do better. What if we made this more interesting? We now have more filters to add in our data visualization, and you can actually select the country of your choice and also select the time frame, which is given in months, of what you want to see. For example, what if you wanted to see how many cases were in India from November 2020 to December 2020? We've got you. If you click India in the filters and narrow it down in the months, you will actually see that India had 300 million COVID cases in the month of November to December 2020. Next, we go into deaths, diving deeper. How many deaths were they? We didn't need a world map to show you this, but we wanted to show you in a very simple bubble map. The bubbles correlate in colors just like the world map did, but they also correlate in size to show you the bigger bubbles have more COVID cases and deaths, and the smaller bubbles have less. Again, we can do better. We narrowed our search down to the European region and picked 3 countries. Why? Number 1, France had the highest death toll in Europe, with Spain following closely after. We wanted to pick a third country that was not as big as the other 2 and did not suffer as much as the other 2, so we can do a close comparison to see how they did in their data screening. So this is our data narrowed down for your ease of reference.
Thank you, Aki. Now let's dive a little bit into some of questions that are really important here. First one being, are vaccines really effective against COVID? And for that, we needed to dive a little bit into the effectiveness being asserted by the number of vaccines being applied on the population versus the new cases. And as you can see, as vaccines go up, the new cases tend to drop. So we can for sure say they are effective. Now, when it comes to the population that are being vaccinated in each country, we can see here that Portugal is almost at 85%, which is amazing, followed by Spain, that it's around 78%, and then France was almost 66%. And you may be wondering, oh, okay, great, Spain is doing amazing with its population being vaccinated. Why do they need the more vaccines? Why are we looking into it? As you can see here, vaccines can also prevent death, because the less people that are sick, less people die. So that's just basic math. And when we were looking at the number of deaths from Spain and France, even though Spain is a little more advanced in the vaccination process, it's still close to France when it comes to the mortality of its population. And here we can see how the population is recovering from COVID. So Portugal, again, doing amazing with 85% ratio of recovery, followed by France, that is 5%, which is really bad. And then Spain's doing even worse with only 3%. And that reinforces the need for Spain to get more vaccines than the other two. And now, why is the population in Spain dying so much, even though they have a great vaccination protocol and they're being vaccinated the regular basis? Well, despite the number of doses being up, deaths unfortunately are still ranging the population. And maybe that's a lot of factors to it, but maybe it can be with the lockdown regulations we're seeing around the news that the Spanish population is not really keen into following those kind of rules. So there's also pre-existing conditions of the population. We know that Europe all around has a great elderly population. They're significant there, and Spain is no exception. So, you don't want to be in lockdown. You need to go around the world, out and about, but there's still some risk factors that need to be considered. And we believe that with more vaccination, more vaccines available to Spain, we can cut the mortality rate. Yeah.
So over here, we have a bar chart that basically shows us how we can use this data to optimize vaccine distribution. First and foremost, we want to see the countries at the highest risk and also identify whether we are underserving certain regions. For example, we can look at the case and death trends and pinpoint where COVID is still spreading. Countries with low vaccine rates but high infection rates should be prioritized for actual increase in vaccine allocation. Number two, we want to predict future vaccine demands and booster doses as well. If we look at the vaccine trends, we can actually estimate that countries that have received vaccinations but are still declining in health and are still increasing in their COVID rates should actually be prioritized for boosters. Number three, we want to identify and solve bottlenecks. So for example, logistic bottlenecks can be identified using the data that we have for doses. If we see here that countries have actually been receiving a lot of doses but not administering out the doses, we have to wonder why, and is there a bottleneck that we can solve? And last but not the least, we also want to identify countries that have low vaccination rates. Over here, you can see a bar chart that we have put, and we have filtered out the countries from the regions of the lowest 15 in terms of the vaccination rates. We need to understand why, from South Sudan to Antigua and Barbuda, why are they not vaccinating their people? Could it be something due to lack of awareness? Could people also be doing it for religious reasons and saying that we can't be vaccinated because maybe our religious bodies say we shouldn't be vaccinated? Are people hesitant because perhaps they've heard rumors that vaccines cause side effects? Do we need to educate the people more, and do we need to tailor this education based on their reasonable and acceptable levels? All this can actually be found out through the vaccination rates that we have and through the data that we have here to enable us to target those countries and get them vaccinated better. Thank you.